Hi guys, my name's Brittany and I'll be giving you a speech on the West Virginia drug epidemic. We all need to know the facts of the drug epidemic in West Virginia and the problems it has brought to not only our families, our communities, but also the rise in overdoses we're seeing each year. The drug epidemic has a devastating effect on families as exemplified by the increasing number of infants, and not only infants, but children who are born to drug addicted mothers and children who reside in homes with parents that are addicted to opioids. According to the National Institute of Drug Abuse, regular use of opioid pain relievers are generally safe when taken for a short time and prescribed by a doctor, but because they produce a sense of epinephrine in some patients, they can easily be missed or abused, causing drug dependency. Opioid use has not only affected the families of people who use drugs, it affects the whole entire community. Everybody. It affects your parents, your grandmas, your moms, so the whole community. And the widespread of HIV and hepatitis C is at an ultimate high right now in West Virginia. West Virginia has the highest age-adjusted rate of drug overdose deaths involving opioids. Just in 2017 alone, there were 833 deaths. That is a lot of deaths due to opioids. The drug epidemic on families and young children, that's huge. There are so many kids out here in the foster system that don't have a choice. They didn't ask to be in this world. They didn't ask for their parents to be on drugs. Foster care placements have risen alongside opioid misuse and death rates. Opioid-related abstinence has skyrocketed, leaving children as the youngest nationwide epidemic. There are 6,900 children that are in the state care in West Virginia. 80% of children in the foster system have been affected by the drug epidemic in West Virginia. That is a lot. In the crisis, 3.5% of infants born in Mercer County alone, 3.5% of infants born in Mercer County were diagnosed with drug withdrawals in 2017. That's a lot. That's more than 4 times the national average. 4 times the national average. West Virginia University team aims to prevent the HIV breakout in southern West Virginia. 28 counties are at risk for a potential HIV outbreak, according to the Center for Disease and Prevention. Basically, we are sitting here really in the belly of the beast. We are sitting in an area that could be a tremendous hot spot. A tremendous hot spot. We got people that work in food industries. We got people working with our children. We got hospitals and doctor's office, and at least 1 in 5 people that work in these situations are on drugs. That means that the widespread of HIV is like so much higher. So much higher for our kids, for everybody. You can't walk down the street anymore. You find stuff laying on the ground. You got to teach your kids about these things. And it's sad. The rise of overdoses in West Virginia. West Virginia has been hit hard by the opioid crisis. In some counties, the death rate for opioid-related overdoses is approaching a similar level of cancer. We're now comparing opioid use to cancer. We need to know the facts of the drug epidemic in West Virginia and the many problems it has brought to everybody. Families, communities, moms, dads, grandmas. schools, everywhere. In 2017, there were over 11 million opioid misusers. 11 million. 11 million people. That is a lot of people. The cost of opioid abuse ranges from $10,000 to $20,000. That's insane. In annual medical costs for those patients, $10,000 to $20,000. The hard truth is that unless bold action is taken, the opioid epidemic is just out there. If we don't find a way to help these people, more rehabs, helping these people with long-term problems, then we're only going to see it rise even more. These drugs are one of the many areas that Greater Harrison Drug and Violent Crime Task Force focus on. They try to keep a handle on what's coming into the area. However, sometimes that's nearly impossible to keep track of every drug coming in and out of West Virginia. Our cops do the best that they can, but it is so hard for everybody to know. All these cops working hard every day, every night, the drug task force out there working hard to try to find out what's going on and what they can do. And in the meantime, we have families that have to worry about their children getting on drugs, their children getting off of drugs. Like, it's a horrible feeling. There has been an isolated case of overdoses related to those substances in north central West Virginia, according to John Walker, Bridgeport Police Chief and Commander of the Control Board for the Greater Harrison Drug and Violent Task Force. Everybody's struggling. The drug epidemic in West Virginia has been a devastating effect on families and is exemplified by the increasing number of infants. According to the National Institute on Drug Abuse, regular use of opioid pain relievers are generally safe when taken like they're supposed to. But how many people are taking them like they are supposed to? What can doctors do to help everybody be able to come off of drugs? West Virginia has been hit hard. It's one of the top countries to have so much deaths and problems with drug epidemic and the overdoses and all the drugs coming into the state, and the facilities with children are filling up. Kids don't have nowhere to go. We don't have enough foster kids. We don't have enough foster parents. There was a film made and put on Netflix about the heroin and opioid crisis right out of West Virginia. Right out of West Virginia. They actually put us on Netflix. If you like Netflix, you'll know. Netflix is huge. That is crazy. This is right in our hometown. And the problem is real, and the people could be someone we may know, family member, friend, or even someone we went to school with. There are many people fighting to save the lives of so many who have found themselves stuck in a world of hell. That's what it is. It's a black hole. It's hell. Once you're there, so many people don't come out of it. We lose friends, we lose family, we lose kids. We lose so many people to the crisis that is going on, and trying to find a way to help people is overwhelming to all the people out there trying so hard. But all we can do is pray and hope, and do the best that we can to come in as a community and help what is going on in our own backyards. A Netflix original documentary short film. It's called 100 Americans Delivery, or 100 Americans Die Every Day from Overdoses. Heroin. This is the original film on Netflix. This was taped right out of Huntington by EMT. She was an older lady. It was an EMT trying to be out there to save people. West Virginia's rate was more than 11 points higher than that of Ohio, which came in second in the nation with a rate of 46.3. Pennsylvania followed with a rate of 44.3. Nationwide age-adjusted drug overdose death rates increased by 9.6% in 2017 compared to the previous year. It even went up higher for 2018, 2019, and we can only hope that it goes down for 2020. The many people that are trying to help parents get the help they need in order to not uproot their children to the foster system, but to also lower the rate of babies born addicted to drugs. If you've ever seen a child born to drugs, it's horrible. It's the saddest thing you'll ever see. The shakes and the withdrawals, and that's no way for a baby to live. The many people and sponsors that are in the state of West Virginia doing everything they can do to get drug users into rehabs, but also helping the communities come together to understand the drug opioid. There's not a lot of people that have knowledge on it. They don't know what's going on. The Drug Task Force works endlessly to not only take drug users and drug dealers off the street, but to also carry Narcan on them to try and save the lives of many people that overdose. We're making drugs to help people who overdose come back to life. That's how bad it is. The EMTs and cops, and you can even buy it at the store, they help people who overdose. And if you've ever seen Narcan work, when they squirt it in your nostril, it's almost like they were never on anything. They just come right back. And they're up, they're good, it eliminates all the stuff that they did, and they're normal human beings again. But that's what it's come to. That cops have to carry this to save the lives of the people that overdose so that the overdose rate can come down. It's really, really sad. So as you can tell, we have an epidemic in West Virginia in our own backyards, and it's really, really sad. So I'm glad you guys listened to me. My name's Brittany. This was a speech on the West Virginia drug epidemic. If you have any questions, just raise your hand and let me know.